Emily, you are a care coordinator at MEIGER Health. How do you ensure continuity of care to patients with challenging behaviors?
At MEIGER Health, we currently have a crisis mitigation team, and that team was selected based off of familiarity with patients, personality types, and cultural preferences. So our clients have certain preferences that they would prefer for staff to work with them. The reason why this team was created was to reduce the amount of frequent hospital visits of our patients, managing challenging behaviors, and also reducing the staffing turnovers in our clients' homes.
The issue is to identify crisis before, or issues before they become crisis. Just call the mother, call the caregiver, call the client, hey, how's everything going? And then they will just start talking about things that may have erupted into a crisis, and at that point you're fine. And then you call them back the following day, they tell you, oh, I'm good, can you come visit? And that's how we do it. It works a whole lot.
Okay, so once again, I'm just speaking realistically. As a native Washingtonian, and I talk to a lot of people who are getting services, I'm realizing as I look at budget numbers and I attend meetings all across the city, that a lot of providers believe that services equate to outcomes. And now that we're in a position where budgets are being looked at, resources are looked at very closely, if I have $10 and I have to serve 10 people, do I give each person $1, or do I pick one person and give them the $9 because they will have the most favorable outcome? And if you're a provider and you're not looking at that perspective and not just checking off, oh, everybody gets case management, everybody gets this, everybody gets that, we're tracking the services, but we're neglecting to actually track outcomes. Because outcomes is what we're looking for. We're not looking for the company that says, I have the capacity to serve these many people because I have these many case managers and these many community support workers. What I'm looking for providers to tell me is that there was a person who was chronically not taking their medication for 10 years, and now this person has consistently taken their medication for a year. I don't hear that type of language a lot of times when I'm talking to the provider community as well as people who are actually receiving services. They tell me, oh, my nurse comes, my community service worker comes, this happens, but I rarely hear the conversation about the outcome.
You must be sitting in some of our planning meetings. I'm gonna let Dr. Ernest address this.
So each client that we have specific goals. Is this an issue of the revolving door, the rehospitalization? Is that the issue? So we track those. So we try to get them back to regain their independence. It's not an issue of providing services forever. So we have goals, we have outcomes. And this is just a training. But then there's a person-centered approach to this. This is just a general thing. Each client has a person-centered approach outcome that is unique to that individual. It could be, a classic example would be a lady that I think, I don't know if Emily spoke to that. She was going to the hospital every other day after the aide left. She is actually the reason we started this crisis mitigation team. Because the issue is, why is she going to the hospital after the aide leaves? And then she would call Janae, oh, I'm having anxiety issues and blah, blah, blah. And we decided that there's gotta be something that we do or we can do. And so she started calling this lady every day after she leaves work. And after that, we realized she's been to the hospital in a week. She hasn't been to the hospital in 2 weeks. She hasn't been to the hospital in 3 weeks. The last time she went to the hospital was September of 2018. Wow. It is significant. And we talk to her every day to the point where we finally assigned, I think she's receiving LPN services, because we realized she wasn't taking the medications also. So that service was added, and it made a difference. So yes, we have outcomes for specific members. We're working with those who participate in the crisis mitigation group. It's about 20 beneficiaries, and so we have numbers for those 20. Yes, so we started that pilot project to eventually expand. So we're looking at this and is it working, what is working and what is not working before we can expand this to the entire population of beneficiaries that we provide services to.